Zeke, it's great to see you. Happy New Year to you. Happy 2023, incredibly. So let's talk about this new strain. Can barely pronounce it or read it. How effective are our vaccines, the boosters, in preventing serious or severe illness?
So XBB 1.5, it's spreading very rapidly, which means it can evade and outcompete the other subvariants. It seems to avoid the antibodies, but also bind more tightly to cells, and that gives it the competitive advantage it needs. And unfortunately, the antibodies, therefore, we have from infection or vaccines don't seem to work. And the monoclonal antibody, Evusheld, we have that a lot of immunocompromised patients don't use, doesn't seem to be working that well. So it is a great concern, and the fact that it's spreading at this moment when people have been traveling, and therefore we're going to see another surge going forward. We can be pretty confident of that.
So is this typical, that the variants keep coming, and as infections spread, this virus finds new ways to conquer our best efforts?
Yes, we do see when the virus spreads to lots more people that you get more variants, because the more it reproduces, the higher the chance of a mutation or a recombination event. And that's actually what's really concerning about China. They will have a lot of deaths, unfortunately, because of the low immunity they have in the population, but also that with hundreds of millions of people getting infected, likely over the next few weeks, they're going to have a lot more variants, and we don't have a good line of sight into those variants and the genomes. And that is what's worrisome to other countries about the China situation.
What measures do you think we should be taking against China? A travel ban, a negative test result? What is an effective way?
A travel ban isn't going to, and the negative test results are just going to, they're delaying tactics. They're trying to get us information. They're not going to help. Individually, for your viewers, Andrea, the best thing they can do at the moment, and I know a lot of them are resistant, is masks. N95, really high quality masks. You can't control what's out there in the airports or what's on a train or what's going to be in a shopping mall. But you can protect yourself with these very high quality masks. And that's what I recommend. This new variant XBB 1.5 is very infectious, and people should do what they can do. Regarding China, I think this is more a moment for collaboration. We've got to get Xi to immunize the population, to slow things down there, and to monitor carefully and share the data on the genomics with the world, instead of constantly denying, everything's under control. There aren't a lot of cases, because that doesn't seem to be the facts.
Is President Xi using the Chinese vaccine, which has not been considered to be terribly reliable, or is he permitting the use of the more modern versions of the vaccine and the booster?
No, they've had over the last year or so a lot of negotiations about buying foreign, especially Moderna vaccines, and they wanted the intellectual property that Moderna had, and Moderna refused to share it with them. They keep claiming that, they've got their own mRNA vaccines, but that's been the claims for about 6 months, and we haven't seen anything. They're really hard to make. It's not easy. They have 200 different separate components that have to go into them. He should be buying the Moderna and the Pfizer vaccine and using it, especially for the older population in China. But there doesn't seem to be an indication that he's going to do that. It seems to be national pride trumping public health, and that is the wrong place to be. Every time it's the ego over the facts. It doesn't work out well. The facts seem to win, and in this case, the virus is winning.
And are Moderna and Pfizer working on a new booster, perhaps, that would be effective against the XBB 1.5?
Well, I don't know exactly what they're working on. I got to believe that they're taking it very seriously, especially if it's evading their vaccine and evading prior infection with Omicron. And the problem is, even under the best circumstances, it's a several-month process, and it's not going to be ready in time, probably because You know, these surges are about 8 weeks long, and by the time everything gets revved up for production, distribution, you know, it's not going to be enough time. What we really need is a universal coronavirus vaccine, and they're certainly working on these things.